and that is really equity. Since we started this vaccination program, one of the things that we have focused on and frankly been concerned about is inequality in healthcare and inequality in regard to how these vaccinations might be being administered. Pandemic has highlighted significant inequities in our healthcare system, things that we knew, but they were really brought more to the surface during this pandemic, and we've seen them. We've seen them throughout the 11 months of the pandemic. The truth is that there are Ohioans, there are Americans who simply do not have equal access to health care. We've worked hard to address these gaps, and especially in our efforts to roll out the vaccine. But it is a work in progress, and we have more to do. Let me start with geography. When we create our plan to distribute vaccine, we intentionally chose to make sure that there are multiple vaccine providers in every county in the state. Some states made another decision. I'm not being critical, but their other decision was to have bigger locations and fewer. We recruited a network of providers so that Ohioans would have access to vaccine no matter where they lived in the state of Ohio. This week, we're using more than 700 providers around the state to receive our vaccine. And that's why, again, why we did it. It would have been a lot simpler to go to some mega sites. We decided we wanted these into every county, every community, people to have access. Let me talk for a moment about our federally qualified health centers, our FQHCs. We also made a conscious decision to provide vaccine to our federally qualified health centers because they serve highly vulnerable neighborhoods in our cities and also in our rural areas. These community health centers are where many Ohioans seek health care, and the people are used to going there for services. By offering vaccines at these facilities, it's another way that we're making vaccine available for equitable distribution. More than 60 of these centers are receiving vaccine this week. Let me talk about some pop-up vaccine sites, something we've started and will continue to do. We're also working with the federally qualified health centers, with our faith-based communities, and with local health departments to pilot pop-up vaccination sites in at-risk communities. We hosted 2 days of these sites in Columbus last week with Primary One, which is an FQHC, and we have another scheduled this week in Cleveland, and we intend to do more as we move on into the future. Talk about transportation, which we know is always a challenge. For poor people, it's a challenge for underserved communities. The Ohio Department of Health is working with partners at the Department of Medicaid to provide transportation options to make sure there are no barriers for those who want to receive a vaccine. Again, though, it's a work in progress. Let me talk about our local health departments. I talk to our health departments every Monday morning, and they're doing a very good job. And one of the things that we noted from our call this past Monday is that there are a number of them that are setting aside doses every week when they come in for underserved populations. So many of our health departments are prioritizing underserved populations. For example, in urban areas such as Dayton, Columbus, Cuyahoga County, the health departments are partnering with faith-based communities, senior centers, and other organizations that work to serve African American, Hispanic, Latino, and other underserved populations to provide education and offer opportunities for vaccination when vaccine is available. So that is an ongoing process as well. And some of them, as I said, are just literally setting it aside to make sure these underserved populations are in fact served. Another example, in Athens County, when Ohioans are scheduling appointments, the local health department is connecting vulnerable seniors with transportation options. They also are partnering with their senior groups to help with communication and connection to at-risk seniors. As education, let me talk about our education and our communication strategy, because we know that we have two challenges. One is to make these vaccines available in convenient places and allow people in underserved communities to be able to get them. The other challenge we have, of course, is to make sure all Ohioans, have information about the vaccine. And what we have found, starting with nursing homes, that the more information people had, the more likely they were to take the vaccine. No one's going to be compelled to take the vaccine, but more good information makes it more likely that people will take that. As part of our vaccine planning, we create a minority health vaccine advisory group whose mission it is to help advise us on how to best deliver the vaccine to underserved populations and better ensure equity. This group is made up of a broad range of advisors, including healthcare professionals, community leaders, clergy, people from our Appalachian communities, minority small business owners, and advocates from around the state. We're listening. We're listening to this group, and we're getting their feedback. We will continue to gain, by doing this, a much better understanding of the barriers to vaccination, and this will help us develop solutions. One example of this work is our launch of a series of virtual town halls. This will begin live streaming the week of February 22nd. You can find more information on how to participate in these events on coronavirus.ohio.gov website. Also on the website right now are toolkits for our community partners with information on the safety and the effectiveness of the vaccine. Additionally, we have started paid media efforts, including television advertisement that are on the air now, with more to come, and radio spots concentrated on minority radio stations. Further, we'll be sharing vaccine information in both African American and Spanish language newspapers. We've also developed an education toolkit for our community partners, such as leaders in the faith-based community, leaders in the NAACP, the Urban League, so that these trusted leaders can have accurate and up-to-date information on the safety and the effectiveness of the vaccine. I'm proud to announce that next week we will host 6 vaccine events in senior affordable housing complexes. I've asked our Director of Aging, Ursel McElroy, to join us now to talk about those plans. So, Director, thanks for joining us. Tell us about what your plans are for next week and what we're going to do.
Absolutely. So thank you, Governor. And we are pleased last week when you announced the plan to coordinate vaccine clinics for our citizens living in affordable senior housing. And we understand this is a critical mission to help the state ensure equity and access to those who might not otherwise have a chance to get vaccinated. So whether their barrier is location, mobility, or access to care and education about the vaccine. There are about 87,000 older Ohioans living in these sites. We've identified more than 700 sites within high-density metropolitan and suburban areas. And this approach will make it possible for us to take the vaccine directly to their homes, and this will serve as tens of thousands of older Ohioans. The Department of Aging, in partnership with key state and local organizations, will offer these on-site vaccination clinics at these housing communities. And we're calling this the Regional Rapid Response Program, or RAP. And these on-site clinics will utilize teams of experts coordinated with support from the Ohio National Guard. We know that these clinics will be convenient, accessible, and equitable. So 1, they eliminate the need to arrange transportation to an on-site location. 2, these clinics provide screening for isolation and resources for wraparound services. And 3, we believe it will ease the demand on our local vaccine providers by sharing the work. Now, in addition to using population data, we're working directly with city mayors and other local leaders to strategize the implementation and to guarantee that these clinics are done efficiently and equitably.
Very good. 6 next week, I believe. And
yes,
then,
absolutely. Yes, and we're excited. We're excited about the 6. With the 6, we are utilizing the area agencies on aging, as well as other providers, so that when you come to get your vaccine, you will also have that connection point to very important programs and resources. So as you know, there's about a 15-minute period after you're vaccinated that you have to be observed. And this is a critical 15 minutes for us to have an opportunity to connect with and to better appreciate any concerns around isolation or service needs. And we also will include information on tips on avoiding tax fraud this time of the year. We've got recipes in there for local food pantries. We're really excited about this opportunity.
Well, that's great. And we intend to continue this week after week. We have a number of sites that you said we've identified around the state. And I know one of the things when you and I first talked about this, you told me you thought it was better to wait until we were open for 65 and older, so that when you went into these facilities that you'd be able to get a bigger group of people and would not have to turn too many people down because of the age issue.
Absolutely. And most of these sites, many of the ones, for example, that we're beginning with next week, many of them are 200 plus individuals within these sites. And so, again, going on the 8th makes it possible for us to be able to service as many people that want it within that building.